Okay, approach to a short case. This is an 11-minute station. 3 minutes are outside, 8 minutes are inside. This station will usually look at only one of the following components of a consultation. So history or examination or investigations, interpretation results, differential diagnosis or management. Or the station may look at another part of GP life, such as Aboriginal and Torres Strait Islander health, explaining public health measures, dealing with an angry patient or family, alternative health, or alternative medicine, non-compliant patient, breaking bad news, immunisation objection, how to interpret an ECG, travel advice, or evidence-based medicine. Remember to do what is asked. If it asks you to examine the gait, then look at the patient walk. Don't take a history. Okay, let's go through an example of a short case. So the STEM you'll be given, Megan's 30 years old, she's got no allergies, she's married with no children, she's a speech pathologist, there's no significant family history, no current medications, no significant past medical history, rarely drinks and doesn't smoke. So you're not really going to get very much from that STEM, unfortunately. Okay, so you're going to go in and introduce yourself to Megan and ask her why she's here. Now, the examiner and the patient have the story in detail. You only get little snippets as you ask for it. So their story is, Megan is a 30-year-old and she's really angry. She was recently diagnosed by a colleague of yours with breast cancer. Can someone press mute? Okay, thank you. She feels that someone still needs to press mute, please. Can everyone just check their mute buttons? Good, awesome. She feels that the way that, sorry, this is difficult with this, I've got feedback through my ears. She feels that the way, that sentence doesn't make sense. She feels that the way that she was recently diagnosed with breast cancer exacerbated her trauma. She has come to talk to you about the way that the news was broken to her, and she's quite upset by it. Her impression of the consultation was that your colleague told her that even though the fine needle aspiration had come back positive for breast cancer, that he had told her that she didn't have it. He did, however, refer her to a breast surgeon. Now, the information that is freely given by the patient. All of the information is freely given. The patient's angry, she's quite confrontational. This anger is made worse if you tell her that she is wrong or if you don't seem to believe her. Okay, so this takes us how to deal with difficult patients. So you can demonstrate genuine interest in their life and less so interest or even boredom in the listener's complaints. So when they start going on about why they're angry, reflect back to them and go, so how are things going now? What's the doctor said? And try and, steer them back into something that's actually quite constructive. Be honest and maintain trust with the patient. Be polite but assertive. Remain calm, it's probably a big one, comfortable but concerned. Allow the patient to vent their feelings and verbally reflect that. Recognise the relationship between fear and anger. So she's probably angry and she's just wanting to lash out because she's really fearful. Avoid using labels and placebo therapy. Be honest about your understanding of the problems. Don't undermine other doctors. This is only one side of the story. But also avoid collusion because that will also make her angry. Don't abandon the patient and arrange follow-up. And don't touch the patient, don't be angry, don't reject the patient, don't be a wimp, don't evade the situation, don't talk too much. It's a very, very fine line. This is actually based around, not completely, but based around a patient of mine and the consults that I did with her. And so, yeah, these are real life examples of what actually happens in GP and how to actually manage them.